When we talk to patients and try to see who is a candidate for genetic testing, we look at their family history as well as their personal history. Certain cancers that we look at, because we know that there's genes that could be involved in them, are breast cancer, ovarian cancer, colon cancer, in some instances gastric cancer, melanoma, pancreatic cancer, and thyroid cancer. The most common genetic syndromes are the breast and ovarian genetic syndrome. Those are caused by a BRCA1 and BRCA2 genes, and they can predispose individuals to getting breast cancer, ovarian cancer, in some cases pancreatic cancer, and melanoma. As far as colon cancer, there's two major genetic syndromes. One of them is the familial adenomatous polyposis cancer syndrome. That one predisposes individuals mostly to colon cancer and gastric cancer. There's another syndrome called the hereditary nonpolyposis colorectal cancer syndrome, or Lynch syndrome. Individuals that carry the genes of that syndrome can have a higher risk of colon cancer, uterine cancer, gastric cancer, and ovarian cancer. Those are the most common syndromes that we know the genes involved in. If we have an individual who is diagnosed with colon cancer at a young age, there's a high likelihood that the reason that they got the colon cancer is that they have some gene that can predispose them to it. When we look at that individual, we always ask them to have counseling for genetic testing, and then we look at two specific syndromes that can increase the risk of colon cancer. One of them is called FAP, familial adenomatous polyposis. The other one is called HNPCC, the hereditary nonpolyposis colorectal cancer. And as you can see in this slide, both of these syndromes can cause colon cancer in younger individuals. Based on their family history and their personal history, we recommend specific genetic testing to be done. I always encourage patients to be proactive. It is their health, and regardless of how much their physician wants to take care of them, sometimes they forget. So they should be proactive and ask whether they qualify for genetic testing and genetic counseling. And they should do that themselves, even if their physicians do not tell them that they should go for genetic testing. We recommend that when we do genetic testing, we also include genetic counseling. The counseling session is around 1 hour long. It involves a genetic counselor that really explains what the testing involves. It explains what we do with the results and how we interpret the results. And that's very important for the patient to understand before she undergoes a genetic test. We have our cancer genetics program at Northwestern University, and we see our patients together with the genetic counselor, and then we counsel them on whether they should or should not get testing done.